Hello everyone, I am Kimberly Camero from NU Ward 215 College of Allied Health, International University, Manila. Today I will demonstrate moving and positioning patient in bed. Correct positioning of patients is crucial for maintaining body alignment and comfort, preventing injury to the musculoskeletal and integumentary system, and providing sensory motor and cognitive stimulation. A patient with impaired mobility, decreased sensation, impaired circulation, or lack of voluntary muscle control can develop damage to the musculoskeletal and integumentary system while lying down. The term body alignment refers to the condition of the joints, tendons, ligaments, and muscle in the various positions. Good morning, ma'am. I am Kimberly Camero, student nurse for today. May I know your name and your birth date? So today I will positioning you and moving you in the bed. So I want you to cooperate with me while doing the activity. So first, hand hygiene to reduce the transmission of infection or microorganism, and then provide clients privacy. So assuming that I already closed the doors and the curtains. So the bed is in flat position and then the client is in a supine position. And then today I will position the patient in supported Fowler's position. So ma'am, are you ready to do the activity? So first, elevate head of bed to 45 to 60 degrees if not contraindicated. So elevate head of bed to 45 to 60 degrees. So assuming that the bed is in the 45 or 60 degrees angle. Now, and then use pillows to support arms and hands if patient does not have voluntary control or use of hand and arms. So imagine that this is a pillow and this is a pillow. So position pillow at lower back. In the lower, so I will put pillow on the lower back of the patient. Lower back, ma'am. I will and then place a small pillow and roll under thighs. So assuming that this is a pillow, so under thighs. So this is the Fowler's position. So next position is the prone position. I will position you, ma'am, into a supine position again. So remove all the pillows. So my patient now is in a supine position. So roll the patients to one side while placing arm on the to be turned alongside of the body. So roll the patient, ma'am. I want you to roll in a side lying position, and then your arms will be placing into your back, and then roll the patient over arm position close to the body with elbows straight and hand under hips. So turn the patient head on one side. Ma'am, I want you to roll. So that's how you do it. And turn the patient's head to one side and support head with a small pillow. And then, ma'am, I will be placing also pillow under your abdomen and below level of diaphragm. So support arms in flex position, level at shoulders, and support lower legs with pillow to elevate toes. So that's the prone position. So next is the position client in 30 degree lateral side lying position. So ma'am, I want you to position yourself into a supine position again. So I will remove the pillows. So my client now is in a supine position. So lower the head of the bed completely or as low as patient can tolerate, and then lower the side rail. So assuming that I lowered the side rail, and position the patient towards you, which is toward the side of the bed, and then raise side rails and go to the opposite side of the bed. So assuming that I already raised the side rails and I am in the opposite position of the bed, and then flex patient knees that will not next to the mattress. Place one hand on the patient's hips and one hand on the patient's shoulder. So ma'am, I want you to flex your knees. And then place my one hand on the patient hips and one in the shoulders. So roll the patient onto side towards you. So that's the 30 degree lateral side position. So we can put pillows on her back to support the position. So next is the Sims or semi-prone position. So I have to turn back my patient in the supine position. So ma'am, you can position yourself again in a supine position. And then next is lower head of the bed completely. So assuming that the bed is in assuming that the lower head of the bed is completely lowered. So place patient in a supine position. So my patient now is in a supine position, and then roll the patient on side and position in lateral position, lying partially on the abdomen with dependent shoulder lifting out and arm placed at patient's side. So ma'am, I want you to lift again your knees, and then I will place my other hand on your hips and then in your shoulder, and then roll up. So her arms or hands is in the patient's side. So place a small pillows under her head, and then upper legs, and then I will be placing sandbag on her feet to support the foot. So that is how Sims or semi-prone position is.